The world is constantly changing. Some changes are gradual and take so long that are hardly noticed, but others are more abrupt and affect all its inhabitants, like the coronavirus pandemic that we all recently experienced. Technological advances have shortened distances in time. In consequence, whatever happens on one side of the world affects the other side almost immediately. As part of a global community, we are constantly challenged to deal with situations that may cause fear, uncertainty, or other concerns that adds up to our daily burdens. Most times, we are unprepared to control our emotions and sentiments, and even without noticing, these situations impact our mental and physical health. As the level of stress becomes higher than what the individual can handle, and if there are no supporting systems, despair, hopelessness set in, leading to depression and, in the worst case scenario, suicide. A report from the CDC published in August 2023 states that suicide is one of the leading causes in the US. A total of 48,183 individuals died by suicide in 2021. On average, one person in the US dies from suicide about every 11 minutes. Suicidal people are crying for help, for support, for someone who cares. Evidence from scientific research has shown that the rate of suicide is lower in individuals who declare themselves religious or spiritual, who have some sort of faith. This result may derive from the fact that individuals who believe in a superior power find support in their faith and/or in their spiritual group to resist suicidal ideations. However, understanding that life and tribulations do not end with death of the body plays an essential role in this decisive moment. Spiritism, explaining the spirit life, the law of cause and effect, reincarnation as a learning process for evolution, clarifies, educates, and gives support, providing hope and consolation. Spiritism helps to understand the causes of suffering and provides the resources to find strength, courage, and confidence. The United States Spiritist Medical Association, or SMA-US, is a 501c3 nonprofit organization that gives voice to scientists, healthcare professionals to communicate their knowledge and experience in spirituality applied to health. Based on the principles of Spiritism, the SMA-US brings science and spirituality together with the mission to educate healthcare professionals and support research on the impact of the spirit soul in physical and mental health. A number of recognized professionals have presented lectures and participated in scientific discussions, including Dr. Harold Koenig, Dr. Christina Pacholski, Dr. David Rosmarin, just to mention a few. The SMA-US also participates in events with the International Spiritist Medical Association, presenting international speakers such as Dr. Peter Fenwick, Dr. Rupert Sheldrake, Dr. Alexander Moreda Almeida, and Dr. Elaine Drysdale, and others. During the first semester of this year, the SMA-US presented a series of lectures by psychiatrists and researchers on spirituality and mental health, and is planning to present a live Q&A on this topic at the end of the year. The SMA-US is now a subscriber of the Religion, Spirituality, and Health Scientific Interest Group of the National Institutes of Health, and announces its events through their mailing list to the scientific community interested in spirituality and health. Support the SMA-US by becoming a member by going to www.sma-us.org.